Hello everyone, this is Dr. J and welcome back to the channel. Happy Thanksgiving to all of you America folk, and if you're not from America, happy Thanksgiving. We always have something to be grateful for. This is just one patient. He was an elderly gentleman, and you could tell by the kind of salt and pepper, really long ear hair that was present at the outer part of his ear. I'm using a stainless steel speculum that's obviously metal and not flexible. And you can see that the speculum, being a nice round shape, does not fit this person's ear canal. This person's ear canal would be considered a crescent-shaped ear canal, very narrow, with a large anterior overhang. And what that does is, as you go deeper into the ear canal, it's going to make you try and look around a corner. And so you'll see here, as we are working on this gentleman's cerumen impaction, it's fairly thick. However, it is thin enough that it's coming up in the suction. And you can also see that the skin is starting to come up very easily. So we're performing a skin peel as we're working our way down into the canal. And as you see here, we convert to a plastic speculum. It's a little bit smaller diameter, but it's also moldable. You can see here I've kind of squeezed the tip of the speculum so that it is more of an oval shape, and then allows us to get a little bit deeper into the ear canal, past the ear hairs, to better visualize what's going on in the ear canal itself. And here we have some more keratinaceous debris or loose skin coming up off of the ear canal. So over time, the cerumen impaction, and because it's not moving out of the ear canal like it should, then prohibits or inhibits the outflow conveyor belt mechanism of the skin out of the ear canal. And so it's coming up with the cerumen as we work our way to the eardrum. And deep in the canal here, we're getting a little kind of a larger piece of epithelium moving up off of the bottom of the ear canal and off the front of the ear canal. We still haven't found our eardrum yet. And I would like to apologize. The gentleman was not very tolerant of being able to hold still for a long period of time. And you can see somewhat of a drifting of the ear canal throughout the image. And sometimes it was a little bit of a cat and mouse as we are trying to clean the ear canal. We're having to move the microscope very frequently and kind of chase his ear canal around a little bit. So I apologize for that. I tried to edit this to a point where you're not getting dizzy and nauseous and such, but there is some movement there, and apologize. Not everybody's able to hold still completely through the entirety of ear cleaning, especially one this extensive. Now we're down to the point where just in the center of this area here is the tympanic membrane, and we are working around the corner. Again, like I said, this is a very curvaceous ear canal with a large anterior overhang. To the right here would be what we call the anterior overhang, and we're trying to work around it. We're looking into the anterior sulcus, and I have a number 5 suction, and several of my number 5 sections are bent, and they're bent on purpose for this reason, so that we can actually reach around these overhangs and get into that anterior sulcus. Now this person they probably don't have perfect hearing, but when you have this level of cerumen impaction, it's going to create about a 20 decibel hearing loss. Pretty significant. And if you want to feel what it's like to have a 20 decibel hearing loss, just put your hand and cover your ear and see how much difference it makes in your hearing. And that's what a cerumen impaction will do. And if you have fluid behind the eardrum, like an ear infection or just fluid that's persistent and doesn't go away, that's what's going to happen, and that's what your hearing's going to be like until that fluid is resolved. So once we're down into the anterior sulcus, we see that there's a pile of cerumen there, and you can see the patient's reacting now. Now that most of the cerumen is out, he's hearing a lot more of the suction activity in the ear canal, and he's reacting to the loud slurps or just noises of the suction as the cerumen is getting evacuated out of the ear canal. And it can be annoying for the person, so we're just very patient. You just gotta work with them in the moment, and so that we can get it done, so that they can go about their life and just hear better as a result. So we do have a pile there in the anterior sulcus, and you can see here it's just starting to lift up and move out. And once it gets lifted up, it's easy to pick up with a suction. It gets suctioned up very easily, and that's very convenient once we get it in a position where it actually can come out. So we still got a little bit there, and again, we're working around the corner right on top of the eardrum into the anterior sulcus, and there's just one more small pile of cerumen deep in there. You can just see the edge of it, and we're going to try and reveal it and get it out here in just a moment. I'd just like to take a moment and thank you for all the positive comments. I just want you to know I read all of them, and I really appreciate those who leave positive comments and are very supportive of the channel. You hold a special place in my heart, and I really appreciate it. You don't have to do a complete ear peel in this scenario. It's more important to just remove there it comes, the obstruction, and then get them on regimen of drops so that this will not happen again. And then some frequent visits usually to make sure that that's happening. Okay, there's the majority of the cerumen is now gone. We have a small layer, a thin layer of combination of wax and epithelium on top of the eardrum. So we're just going to touch it up here just a little bit. There we go. I'm getting some of that off there now. As we are finishing up here, leave me a comment in the comment section below. Let me know where you're viewing this from. Let me know what else you would like to see. Let me know how I can improve the channel, and I'll be happy to try and accommodate as best I can. And thank you so much for all of the, again, positive comments and support for the channel. I really appreciate you guys. And as always, thanks for watching, and happy holidays.